Dr. Hassan.
Thank you. I just got a promotion. Thank you, Chairman Grassley and Ranking Member Wyden, for holding today's hearing. I want to thank all of our distinguished witnesses for being here today. But Dr. Adams and Mr. Mendel, I particularly want to thank you both for sharing your family stories, because in doing that, you really do help combat the stigma that is such a part of this disease and undermines our capacity to treat it. So thank you. As many have mentioned today, a year ago today, the Support for Patients and Communities Act was signed into law. The passage of this legislation was a critical step in addressing the opioid crisis. But the crisis didn't happen overnight, and we know that it will take a continuous and sustained investment at the federal level to curb and ultimately reverse the tide of what is truly a horrible epidemic. I look forward to continuing to work on a bipartisan basis to adequately fund the SUPPORT Act, build on the SUPPORT Act, and expand access to prevention, treatment, and recovery services. I wanted to start with a question to Dr. Adams and Dr. Dennigan-McCauley about services and access for women in particular. The HHS Office on Women's Health estimates that 70% of women entering substance use disorder treatment have children. And many residential treatment programs don't allow children to be present when their mother is receiving treatment. This is obviously a real barrier. We have some good examples of what works. Residential recovery homes that offer services for pregnant and postpartum moms, like Hope on Haven Hill in Rochester, New Hampshire, have proven to be really effective. And data shows that when pregnant women and new moms have access to long-term evidence-based treatment, outcomes improve for the entire family. Unfortunately, recovery homes like Hope on Haven Hill are few and far between. It's one of only a handful available to women in New Hampshire. Moreover, reporting from news outlets throughout New England, as well as the GAO report we're discussing today, have shown that some recovery homes are scamming patients and they're not using the evidence-based treatments we need them to use. One of the best means to recovery for many women is residency in an Oxford house, which is an evidence-based recovery home model that addresses addiction. Yet according to the GAO report, only 29% of Oxford houses in the United States provide recovery housing for women. So Dr. Adams, what is HHS doing to expand access to long-term evidence-based treatment for moms that allows them to remain with their children in a safe environment? And how can Congress support those efforts? That's the question I want you to answer. And then to Dr. Dennigan-McCauley, after Dr. Adams, how do we ensure that we're providing access to the increasing number of women in need of treatment and recovery services, especially given the relatively limited number of high-quality recovery homes that serve women?
Well, quickly, I've visited New Hampshire many times. Few places have suffered as much from the opioid epidemic, but also few places have had as much success in overcoming the opioid epidemic. You've decreased your overdose rates by 10%, and a lot of that's been due to your focus on NAS. I've been to hospitals in New Hampshire and learned about the work they're doing there. What are we doing? Well, ACL has a neonatal abstinence syndrome national training initiative, lifting up best practices, including keeping mom and baby together. I've partnered with Dr. McCants-Katz, the head of SAMHSA, to write an article calling on more OBGYN providers to become trained in MAT so that we aren't playing hot potato with a mom who has substance use disorder, and that we can take care of her. And then two other models I'd mention very quickly. The maternal opioid misuse model will increase access to effective substance use disorder treatment through a focus on improving the quality of care for pregnant and postpartum patients. And then the integrated care for kids model through CMS is a child-centered service delivery program that again emphasizes providing those supports. So couldn't agree with you more, and we are trying to do all we can to provide that flexibility. New Hampshire also has a 1115 waiver, which again provides more flexibility.
Thank you. Dr. Dennigan-McCauley.
Thank you. Yes, GAO is similarly concerned, and we have looked at reports on neonatal abstinence syndrome. We also have ongoing work on maternal mortality, which unfortunately does relate to the opioid crisis. And we have a report that's coming out looking at Medicaid and opioid use disorder services for pregnant and postpartum women as a part of the SUPPORT Act. I think it's actually being released today.
Okay.
So there will be some more information there.
Thank you. I know I'm running out of time. I'll follow up with you, Dr. Adams. Senator Murkowski and I have a bill to help to remove the waiver necessary right now for physicians to be able to do medication-assisted treatment. I am concerned that people don't understand that it's the gold standard and how important it is. I'm concerned about the stigma attached to MATs still, and so I'll have a question for the record for you to follow up on that because we really need to get the word out there how important it is.
Absolutely. Happy to follow up.
Thank you.